So my path to medicine in general was less traditional than most. The early part of my life was actually dedicated almost entirely to athletics. And when my athletic career abruptly ended, it provided me the opportunity to realize my true purpose and passion in life, which was medicine. It was just an opportunity for me to appreciate what was important to me in my life and to really redirect my efforts into something that I found to be much more meaningful than athletics. I had a fair amount of family that was involved in the healthcare field, no medical doctors, but to me, pursuing a career in medicine I realized later was exactly what I wanted. And particularly surgery in general, the decision to pursue that came hand in hand with my decision to practice medicine. Partly because I very much appreciated the hands-on nature of surgery. It was very attractive to me to find a specialty where not only were you able to make a diagnosis, but you were also able to act on that and fix a problem using your hands, and that was always very attractive to me. Growing up in rural Wisconsin, I developed very early a deep found appreciation for core community values. And I feel that general surgery was a perfect avenue to explore, to provide opportunities for people in rural areas which are often, I found, to be underserviced when it comes to surgical care. So my goals at RAMC are to broaden the types of surgeries that we offer and to address those disparities, because truly that's been my professional goal for as long as I've decided to practice medicine. Hands down, the most rewarding part of my job is the patients that I treat. As a general surgeon, oftentimes the first time that I'm meeting someone is in the clinic to address a problem that has severely impacted the quality of their life for some time. Other times, it's a situation where I'm meeting someone for the first time on the worst day of their life. I take great privilege and responsibility when that individual puts their trust and their well-being in my hands. And for me, there's nothing more rewarding than to be able to give that patient a good outcome and restore them to the life that they had previous to that incident, both for them and their family. RAMC really has everything that any healthcare provider is looking for in a healthcare institution. It has exceptional facilities, state-of-the-art operating rooms with state-of-the-art equipment, has a very robust primary care network, excellent support staff, and leadership that is dedicated to patient outcomes and also to being responsive to the concerns of frontline healthcare workers. But what truly makes RAMC unique, at least in my opinion, are the people who work here. In my experiences, the people who work here are kind and compassionate, and certainly not on a superficial level. Likewise, and perhaps more importantly, I've found that there is a cohesive goal here to provide exceptional patient care above all else to every patient who walks through the door. And for me, I simply wanted to be a part of that. I have always been a very family-oriented person. My time outside of the hospital is primarily spent with my family, my wife and my children. Every time we find the opportunity to do so, we choose to spend that time outdoors, primarily sticking true to my Wisconsin roots, whether it be fishing, hunting, swimming, any number of water sports. I think that any time that we're able to spend outside with family and friends is time well spent.